The views expressed in this webinar do not necessarily represent the views, policies, and positions of the Substance Abuse and Mental Health Services Administration or the U.S. Department of Health and Human Services. So as I said, I'm with the Southeast Prevention Technology Transfer Center. These are the states that we serve. We serve 8 states. There are 10 national PTTC centers around the U.S. So if you're not in the Southeast region, you do have a PTTC that is available to assist you. We provide free of service technical assistance and training for the prevention workforce. Our goal is to build the capacity so that you can meet the needs of those in your communities. So we do have an evaluation at the end. You will receive an automatic link to it. You can go to, if you want to know more about, as someone just asked about their PTTC, you can go to the website, pttcnetwork.org, and you'll be able to find your own PTTC there. But like I said, we are going to have an evaluation at the end. You will receive an automatic link to it, and you may get a warning from your computer. You're going to an external site. It's okay. It's just our evaluation that our funder, SAMHSA, really likes for us to do. And it really lets us know how satisfied you were with the information. And you can take your cell phone and put it on camera and just hold it over this QR code. That will send you right to it. You don't do it now. Wait until the end. I will also have this QR code available at the end of the training today. After you complete the evaluation, you'll see this little thing here. It says select this link to continue. That gets you to the all-important certificate of attendance. I know that's really important to most of you. So if you want your certificate, complete that survey, and then you'll have the link, and you'll see it shows up in the bottom in a PDF format. You can customize it with your name. You type in the little blue box and save as on your desktop. If anyone has any problems, don't hesitate to reach out to me. My contact information will be available at the end. So with that, I'm going to hand it over to our presenters, and I'm going to make Carlton, I'm going to make you the presenter so that you can forward the slides, and I will allow you gentlemen to introduce yourselves. So please take it away.
Phenomenal, phenomenal. Thank you, Kristen, and looking forward to this conversation with everyone. Welcome, welcome. My name is Carlton Hall. I'm the CEO of Carlton Hall Consulting. Our team has been responsible for providing technical assistance support to the Southeast Prevention Technology Transfer Center since its inception. It is my extraordinary privilege to be able to share this time and this work with you all, with two of my dear friends and colleagues over the years. At Carlton Hall Consulting, we have been involved with prevention and the implementation of prevention technology for more than 25 years. And over that time, we've had the extraordinary privilege of working with some of the leading thinkers and practitioners in this work. And it has been our practice to try to make sure that we're able to bring that information to bear for you all. I'm hearing a little bit of feedback from me, and if you all are hearing feedback, Tracy indicates so by letting me know that that's what's going on. A little bit of feedback? Okay. So I want to not share or spend too much time if you all are having a little bit of difficulty hearing me. What I will say is that we are privileged to have, as a result of our work, two of the leading preventionists in our field to be providing the bulk of the presentation today. Dave Shavel and I have been working together for more years than we want to admit with each other. But we've been able to work all over the country together and even internationally together. Dave, from our work with Communities That Care and through CADCA and all of the tremendous work that he's been able to do, supporting coalitions in every state in the union and even internationally. He is one of the leading thinkers with respect to prevention science today, and we are extraordinarily privileged to be able to have him as part of the team today delivering this. And Tracy Johnson, who has done more work than I know of anyone, who have been really able to focus a lot of the attention on building the capacity of those communities that are in urban sections of our country, and helping really for those communities to be able to access prevention tools and prevention science and technologies. Over the more than 20 years that he's been doing this, he used to oversee the Center for the application of prevention technologies for the central part of the country, working on behalf of SAMHSA in that regard. One of the esteemed leaders of our nation, it is my great privilege to have been able to partner with him over these last few years. And Tracy, it's great to have you here. They will introduce themselves. They're going to provide the bulk of the training today because if you had 3 presenters, this would be a 3-hour session as opposed to a 2-hour session. And so we were thinking about you all. With that, I want to allow you to know, going in the wrong direction. I want to allow you to know that this is a part of a series, and this series begins with this fundamentals. This was designed for the emerging prevention leaders. So those of you who have a great deal of experience with prevention will likely hear a lot of the tools and a lot of concepts and a lot of the principles that you will have been exposed to over your experience. This is really designed for those that are newly coming into our field and wanting to understand how to apply the tools, the technologies, the resources, and the tactics of prevention science to this new responsibility and accountabilities that they have. And so we are starting with prevention fundamentals today. That's why this one is 2 hours long, because we want to make sure that the foundation was really laid. We will then have opportunities for deeper conversations in our next 2 sessions. The next session being assessment, planning, and evaluation, and that will be followed up by great discussion about how to organize yourselves, organize your communities, organize your institutions for the application of prevention science. That last class that you see that we're referring to as a master class is going to be limited to the first 40 or so registrants for that, because we'll allow for a deeper conversation to be had. And so Kristen will come in at the latter part of this training session to be able to describe when and how you'll be able to register for the master class for those of you who are interested in that. As I mentioned, we will be coming back to you actually next week on December 15th with the second portion of our Workforce Development Series focused on assessment, planning, and evaluation for the prevention professional. We're looking forward to that conversation. So if you haven't registered for that, there is now opportunity for you to do that. With that, I'm going to just share something because I want to see how many of you are engaged with me. So I will share it in this way. Hamjambo, Gina Lakanani, Tafadali. Please put that in the chat box if you wouldn't mind. Gina Lakanani, Tafadali. And we're just waiting for you to put that in the chat box. Well, for those of you who probably couldn't understand what I said, I am the first from my representative from my family who was able to spend a good bit of time in Africa, and predominantly in East Africa and Kenya. And what I just shared, you might not have recognized what I said, but many of you may have recognized what language I was speaking. If you can recognize the language, please put it in the chat box. If you recognize the language I was speaking, please put it in the chat box. I was actually speaking Swahili. That's exactly right. That's exactly right. And all I asked was simply for you to put your name in the chat box, please. That's all that says. And the reason why I'm starting off this way is because I've found that going from community to community to community, that there is no shortage of individuals who care desperately about trying to make change and trying to be able to help support their communities to address the issues that are relevant to substance misuse that's taking place in their communities. However, what they find when they're trying to do that is that they are often buffeted by the fact that they have to learn frameworks. They have to learn the 5 steps or the 7 steps of the strategic prevention framework, or they may have been involved with communities that care, and you need to know the 5 phases of communities that care. And if you don't know that, then you might want to understand the 5 phases or the 5 steps of collective impact. Or if you haven't learned that, then you're probably being introduced to those phases and elements of the social ecological model. And if the social ecological model means anything to anyone, it's probably going to steer you towards the social development strategy. And you can't dare learn more about the social development strategy without understanding the importance of those social determinants of health. And many of you who have learned all of that understand that those social determinants of health are probably necessary if you're interested in social investment strategies or community-based assessment strategies or health and all policies or screening, brief intervention, and referral to treatment, and even the 40 developmental assets. The point that I'm trying to make to everyone here is that those of us who come into this field are often first engaged with a bit of language that has us sounding like we are speaking Swahili when we are trying to engage our communities. The real purpose of this series is to help us to break down those concepts and those tools so that we're not speaking Swahili when we're trying to engage the communities in this practice of prevention that is so vitally important. And so with that being said, I'm going to stop and I'm going to actually take the opportunity to share, to provide my friend Tracy Johnson with the opportunity to present the screen and to begin this process. While he is speaking and while our presenters are speaking, what I would want to encourage everyone to do is please engage with us with the chat. Both myself and Kristen will be monitoring the chat so that we might be able to engage with you. If you have questions or if you have thoughts, please place them in the chat. We'll be engaging with you there. And with that, Tracy, thank you so much and take us into this training.
Good morning, everyone. Thank you, Carlton, and welcome to all my preventionists in the field out there. It is an honor and a privilege to be a part of this today. And today we want to, and my work is not only working with Carlton but with TTJ Group LLC. We provide an array of training technical assistance services around the country. And this is just one of them, working with Carlton Hall and Associates and people like Dave Shavel. It's just an opportunity, and I'm blessed for the privilege to do this and to definitely speak to you all today. So allow me to move forward. Let's get at it, as my friend on CNN said. Let's get at it. What is prevention key concepts? So one of the things that I definitely always want you to know is that think about what those prevention key concepts can be. We know that prevention is really about, giving support to people who are dealing with and struggling with concerns and issues, but giving them resources that can really help them succeed is one. We also know that prevention is a collective collection of what we all consider culturally appropriate and evidence-based programs and activities, which really help us to support folks and keep people from moving into that next level of misuse or abuse of substance use disorder. We also know that prevention is also actually delaying or preventing the onset of any behavioral problems as long as we can, and making sure that doesn't take place. We also know that prevention is really the awesome adoption of effective prevention practices within a framework better than just trying to do things in individual turfisms. And I know that doesn't happen in your community, because your community don't have those silos and those turf issues of kinds of concerns. But we know, and sometimes in prevention, silos can keep us from doing really good prevention work. And the whole idea of good prevention is that effective adoption of practices within frameworks, as many of the frameworks that Carlton showed you earlier, particularly the strategic prevention framework we'll talk about later. We also know prevention is common data sets. Looking at those common data focuses across all the systems, service systems, that can really help us identify, what particular effective program, a prevention program that we can use that will really target and focus on the population that we're trying to serve, or your targeted area. But also it allows for that real importance of accountability. In this prevention field, we sometimes tend to not think about that accountability piece, and that gives us credibility if we're able to say, if we were attacking and dealing with prevention from a data set framework, that allows us to know that we made some adjustments and some changes because of the prevention and interventions that we've developed. And that's what prevention is about. And prevention is where it is as a key part of the continuum, and that's just as important as well. One of the unique things I love about prevention is that for the communities that I've been fortunate to work with, that it's all about across that lifespan. I mean, it starts with the littlest infants and little ones like my grandchildren and great-grandchildren, all the way to my family, my parents, my senior adults, my folks who are at the later part of lives in terms of, but all in between. We know from dealing with things like the effects of maternal substance use to, dealing with young children and how to deal with why secondhand smoke and focusing on those drug endangered children, to our key population of adolescents. And there we would try to stop the onset of experimentation. And then to, of course, our college age and adults, and how do we look at that perform of the whole issue of substance use and dependence, and how do we reduce that as well. And then we also know that prescription drugs have really impacted many older adults and citizens around the country, and that prevention is really focused on that lifespan idea. We also know that the historical part of prevention, it can go back even further than what we listed here. But as Carlton said, this could be a long training. We don't want to do that. But what we want to talk about is quickly is the history of prevention is really focused. Can start in this areas around in the 50s when folks started using that whole idea of scare tactics, and at that time the strong drug of choice was heroin, and so that was a strong issue back then. And many times people use scare tactics as that dynamic piece. And then and it moved on even into the 60s, and then finally in the 70s you start to see this change of moving away from scare tactics as the so-called war on drugs became an issue, and then you started seeing more drug education, using some curricula to really impact that. And then came that for some of us who remember that Just Say No period, and that campaign of helping young folks and helping parents become involved in this. And you begin to see more and more parent-formed organizations to combat alcohol and drug abuse. And then the 1990s, and when I really began to get involved, we began to see more of that community-based approaches to prevention, which really talked about that evidence-based, that research-based, using the Dr. David Hawkins and Rico Catalano risk and protective factors, using some community-based collaborations to really impact and engage to this piece. And then finally, we began to see as of late in the 2000s, that whole emphasis even more on evidence-based programs, environmental strategy approaches, sort of that broad-based, population-based level change, and understanding that connection really, as of late, between how substance abuse and mental health has that connection and that framework. I will now turn it. That's a quick review of history and prevention, and I'll now give the privilege to turn over to my colleague Dave Shavel, who will touch base on that next piece. Let's see here, David. I am going to my part and making that connection.
I just made him the presenter for you,
great.
so you don't have to worry.
Thank you, Kristen.
You bet.
Asante Sana Tracy, Asante Sana Kristen, Carlton, Gina Longu Dowdy. I spent 2 years in the Peace Corps in Kenya, so I think between Carlton and I, we can probably order dinner at a restaurant with the extent of our Swahili. It is a pleasure to be here on the call, and I thank you all for allowing me to join you. I'm calling in from Portland, Oregon, so I'm an honorary member of the Southeast United States for about 2 hours today, and thank you for allowing me to join you during your morning and afternoon today. And as Tracy was talking about, and Carlton has mentioned, there's a lot of concepts. And again, today is the first of our sessions together, and we really want to go over these key concepts. And as we go through, we're going to walk through, Tracy has already mentioned some of these, we're going to be walking through the public health approach to prevention, the continuum of care. Tracy's mentioned risk and protective factors, and how we want to use comprehensive strategies. That's one of the lessons we learned about making change in communities. As we go through today, another thing we'd like you, or perspective we'd like you to have is, again, some of you may be working with coalitions, some of you may be working with prevention providers, others may be working with government agencies or any other sectors. What we'd like you to do is think, what is the role that your organization plays in implementing this particular concept? So when we talk about, say, the risk and protective factors, we'll be talking about how your coalition, your organization, your coalition can apply these principles in your work. And it's important that these, as Tracy mentioned, we've learned a lot over the years with prevention. And as we move into the second and third and fourth sessions of this training series, we will be applying these key concepts in our work as we go through assessment. We want to assess what are those risk and protective factors in our community. So again, these are the foundational principles of this, and we've just started a poll. We'd like to do is just to get a sense of, if you can, keep this open for about a minute, and some of you have already started to answer, which of these topics are most important to you? Some of you, again, are familiar with these. As we go through today, it gives us some information for delivering this training, as well as moving into sessions 2, 3, and 4. So we'll give a second, and Tracy, the poll has ended already? Okay. So the poll looked like just a few of you were able to answer it. And again, majority, if you're saying majority said that we want to look at the role of prevention. So again, as we go through today's session, I'll be checking in with you, and Tracy and Carlton and Kristen will be responding to your questions. So please put your questions and comments in the chat box as well as we go through this. So if I'm able to do this, we want to start talking about the public health approach to prevention. And we start with our friend, the fish here. And one way of looking at this, if we have a fish in a pond and we notice, we look in the pond and that fish is sick or not looking well, we could take that fish out of the pond and give it medicine, clean it up, provide it fresh water, and put it in a separate tank, and we can get it healthy again. But then we think about what happens when we put that fish back in the pond. And if we haven't done anything to the pond, whatever virus or bacteria or pollutant was in the pond that made the fish sick, it's going to experience that same and potentially even get sick again. So when we talk about a public health approach, what we're talking about is not only providing support services for the one fish, but if we want to look at the entire pond, because if we change the water, if we make the pond healthy, we're going to change it not only for that one fish, but for every single fish in that pond. And so that's what the public health approach is about. And part of our efforts, and we'll talk about this when we talk about risk and protective factors, we want to walk upstream even and find out what's causing that pond water. Is it pollutants? Is it virus? Is it bacteria? What's causing that water to make the fish in the pond and other species in the pond sick? So again, we want to do that assessment to say, what do we need to do to not only provide services to the individuals, but to the entire community of the pond as well. And so what that is the public health approach. And the public health approach, many of you know this, is around 3 elements: the agent, the host, and the environment. And so when we look at this, and obviously the fish is going to be the agent. That's the individual we're dealing, the fish is the host. That's the individual that we're dealing with. The agent is the pollutant, the virus, the bacteria, whatever's causing the host to be sick. And the environment is obviously where that fish and the agent host and the agent interact with each other. So we talk about doing prevention at the intersection of the agent, the host, and the environment. So that's looking at it from the CISH standpoint. If we look at it in terms of our work with prevention of alcohol, tobacco, and other drugs, again, the host is, Tracy walks through our entire lifespans. There are different ways people interact with drugs. So the host is the individual, the agent is the particular drug, and the environment is obviously where they interact. And you think about, we always say in prevention, when you've seen one community, you've seen one community. So each community is unique. Each community has its own environment. Even within a community, that we'll see there's different domains where those domains, family, school, community, individual, peer, that environment interacts how the host becomes involved with the agent. And a good example, we raised 2 children. If we would have kept our girls in the house with no drugs at all in the house, and we never let them outside, they would never have exposure to the drug. They might have some problems with their parents or social issues, but they would not have a drug issue. It's when that interaction occurs that they may choose or not choose to engage in that drug use. So the whole point is when we talk about your roles, we want to look at the environments that young people in our communities are living in, and we'll talk about this. What is the availability of drugs? What is the promotion? What are the norms around drug use? And so that's where the public health approach applies to our work. And we're seeing this very clearly, this same public health approach in our dealing with unfortunately, with the COVID-19 virus. And so we look at the same thing. The host is the individuals, and basically it's everybody in the entire world. The agent is the COVID-19, and the environment is, again, unfortunately, the entire world. And so when you think about what strategies we put in place, some are individual focused, wash our hands, wear a mask, keep yourself 6 feet away from each other. And then there are some changes to the environment. We keep the environment clean. The stores are changing how close you can be with each other, your direction. In crowd size, there's just a lot of environmental changes. So when we're talking a bit about comprehensive strategies, we're looking at both individual and environmental strategies that change, again, how the agent, the host, and the environment come together. And so what I'm going to do is just ask my colleagues here, is there anything you want to add to that? Because really, when we talk about doing prevention, it's really talking about, again, looking at that intersection of the agent, the host, and the environment. We can put in place policy-based strategies. So again, if we're talking about youth are getting alcohol from homes and parents are providing it, we can do social host laws. If they're getting it from retailers, we can do retailer training, responsible beverage server training. So again, depending on what that looks like, then we can do strategies, policy-based strategies, and if we impact the entire environment, then we can talk about community level or population level change, and that's what we want to see. I'm going to ask just Carlton and Tracy, you want to add anything to this important point?
Sure. I think, Dave, thanks a lot. I think one of the critical pieces that you also added is that, many of when you use this public health approach and any of the approaches, it can apply to any prevention. I think one of our viewers talked about gambling. And so when you look at prevention, understanding that, using the agent, the host, and the environment can also be applicable for all types of prevention work that we do, and that utilizing this whole framework of population level, because I can recall being back running a nonprofit and doing my prevention as a prevention specialist, we were more focused on direct service. But using this population level the change and policy-based strategies, we can now impact even broader populations within our communities and within our neighborhoods even more effectively. It still doesn't take away the ability to have to do really, really direct service, but I think the public health approach allows us to really dynamically impact a broader group of populations. And the tobacco folks showed us how to do it really well, the tobacco prevention folks. And that strategy really helps. And as you said today, even with COVID, the impact of really having that public health approach impacts our populations quicker and faster and more sustainable in the long run.
Well said, Tracy. The only thing that I would add, as preventionists, we are the only ones that are typically looking at all three and considering all three. Law enforcement, for example, will often focus primarily on the agent and what they're doing to address the agent, for as an example. Treatment services typically respond to how they're addressing and helping the host. prevention and preventionists, and those of you who are in this field understand the vital importance of that relationship and making sure that that's part of the consideration in all of our planning.
Thank you, Carlton and Tracy, and perfectly. And what you're alluding to is we can look at our role when you look at coalitions, what their role is in substance use prevention coalitions. Exactly as Carlton said, we're looking at the entire environment and saying, what are the roles that our sectors can play? How can we're not going to do everything. How can we coordinate strategies at the individual level and at the environmental level as well? So again, that's the role. And some of you that may be associated with a prevention provider, you're looking at, again, impacting both individuals and the environment of those individuals enrolled in your programs and strategies. And so what we want to do is, again, take a look at each of these from that perspective of what is the role. And the second one that we'll take a look at, and Tracy mentioned this, is that continuum of care. And we recognize in communities that there's a range of services that we, in addressing substance use and misuse, that we can, as a community, provide to support the individuals and try to impact the broader community environment. And a way of telling this story, of introducing this, there's one other point. One of our goals here today is to provide you with tools to be able to share this with others. So again, the fish in the water, you can talk about a frog in the water, are great ways to explain the public health approach to people. When we talk about the continuum of care, a lot of times we tell the river story, and the river story is various ways to tell this as well. One, there is a town by a river, and there's a couple walking along the boardwalk, and they noticed that there was a child in the river, and the child was yelling, "Help me, help me." And so couple saved the child, jumped into the water, saved the child. They went and called 911, and they saved the child, and they felt really good about that. Well, the next day there were 2 children in the water, and the day after that there were 3. And so the couple in the town got a little tired of trying to always jump in the water and save it, so they put up a rope. They made a road from the hospital, and they parked an ambulance to try to save the children. And so they made a really good effort to save the children that they were finding that were in the water, saying, "Help me, help me." And so the town finally said, and many of you are thinking, well, why do we only wait until they get in the water? Let's walk upstream and find out how the children were falling into the water in the first place. And so, again, they started to walk upstream. In this particular town, when they walked upstream, they saw that there was a basketball court that was by the river. And so the children would be playing basketball, and they would shoot the ball, or the ball would leave the court, and they'd go chase it in the water, and they'd fall in the water, and they'd be swept downstream. And they also found that sometimes if there were storms, the water would flood, the basketball court would flood, and so the people in the area would be swept down the stream in the flood. So once they walked upstream and they saw what the reasons why the youth are falling into the water, then they can develop strategies around that. And so that's what another way of looking at prevention is, talking about walking upstream to find out what are the root causes, or we'll talk about the risk and protective factors. So how can we, again, protect young people, if they are playing basketball in this example, from falling into the water? So some of you, if you want to put in the chat box here, I know you're already thinking about this. What are some of the ways, if they're a basketball court by the water and there's flooding, what are some of the ways, once we know that that's the environment upstream, what are some of the ways we can address this? And if you're, again, you can put some ideas in the chat box, but some people have talked about putting a fence around the basketball court. That would be changing the environment. Some people have talked about, well, if we teach the children to shoot better, then they won't miss the basket and won't go in the water. So that's an individual skill. We can move the basketball court. We can move the river. So there's a lot we can do. We can move the court. There's, again, if there's flooding, we can do things upstream from the flooding to control the water. That's a big environmental strategy. So again, there's a lot of things we can do at both the individual and the environmental level to keep kids from falling in the water, netting around, so to keep the basketball. I've heard some people say move the goals. Some people with a big budget said, let's just buy a bunch of basketballs, so if one goes in the water, they don't just get another one. So again, it depends on what resources we have. So the whole point of this is to be able to say that in a given community, there are children who are falling and people who are falling into the river. We want to save them. We also want to walk upstream and do prevention. And that's when we talk about the community of care. And this is from the Institute of Medicine. One where, again, we try to frame what does this look like. And we haven't mentioned this, but there's a handout that will be provided after this that explains this in detail. So at our 5,000 foot level, when we look at this, it's really talking about the range of services, if you will, or the range of strategies that a community can put in place to really address the entire river situation. We want to provide promotion, information that talks about healthy practices around even just general topics around diet, around exercise, around what makes for healthy living. Then when we get into a particular topic, in our case, looking at drugs, then we can talk about prevention. And there's different levels of prevention. We'll talk about those in a second. But prevention is walking upstream. Tracy provided a really good definition of really taking a look at what we can do to try to keep people from becoming involved in drugs in the first place. Then if you look at the vertical line, that's where we call case identification or intervention. When people develop a substance use disorder, then they move into treatment and recovery. And in some sense, it's a circle, because when people are in treatment and recovery, we want to prevent them from having further issues with the problem. So what we want to do is really provide a range of these services throughout the community. And again, here's where we get back to what is your role of your organization. Some of your organizations may be providing services across the continuum. Others are looking at different aspects of the continuum. And again, just as we talked about, within prevention, there are 3 levels. And as an overview, when we talk about universal prevention, these are strategies that provide services or information to whole swaths of people without selecting populations based on any criteria. We can provide it if we put up a billboard in the community. That's a universal providing information. If we provide curriculum to an entire 5th grade class, that's a universal strategy. We're not selecting them for any reason. Selective means we're working with fewer people who were exposed to particular risk factors. So if we know that there are children that are living in households where parents have a history of substance use and misuse, we want to make sure that they have special support and services. If we're working with children who have experienced adverse childhood experiences or trauma, we can't change that, but we can make sure that they have services and support. So these are selective or targeting strategies where we're selecting people based on their exposure to certain risk or at risk, if we can use that. Some people call that at promise. However, we're selecting them for some particular reason. That indicated are those individuals who have started. They haven't developed a substance use disorder, but they're starting to experiment. So again, if youth are in violation of, say, their school policy, they haven't, again, they're just experimenting, they're starting their use. Let's do real targeted individual strategies that helps them desist from further use and really supports their making healthy choices.
And David, if I can add something real quick here.
Please do.
If our audience really remember that last slide is a continuum of care, and then this continuum of care as it relates to prevention, is that this really is saying that we have to engage all levels of our population to deal with good, solid prevention, from the minute that we promote good activity and strategies of prevention to all the way to making sure that there's treatment and recovery available for those families that of children who may need that as well. And that the greatest thing about the continuum of care is that this is a document that was developed at the Institute of Medicine, and your dollars at work for tax dollars being worked, and using this says that prevention is not alone in this, promotion is not alone in this, treatment is not as alone as this. And so we at prevention have to understand the dynamics of bringing all aspects of the continuum around to our population that we serve. Although our role is focusing on prevention, we know we got other partners that should be connected with us to do the work.
Thank you, Tracy. And that's a great way to look at it. What is the role of your organization? If you're a coalition, are you the convener? Are you part of a broader community effort? So again, it's to say, one, what is our role in this? Who are the population we're serving? Can we make connections to other services that are needed? Thank you for that, Tracy. And so again, what we're talking about, the key concept so far is looking at this public health approach. How do we look at the environment where the agent and the host come together? We also recognize that there's levels of services that we can provide along the continuum depending on people's use, experimentation, or more severe use. And which allows us to move into, if Carlton want to add anything or any other points. we're going to move into the third, which is risk and protective factors. And so when we talk about risk and protective factors, this is when we walk upstream and we find out, okay, what are the conditions? What is that environment in the community, in the family, in the schools, in the homes that's contributing to the likelihood, increasing the likelihood that young people make the choice to choose to try a drug or to use a particular drug. Tracy said these risk protective factors apply to a lot of different behaviors. We're looking at it from a perspective of drug use here. So when we talk about risk and protective factors, it's really looking at both. We want to say again, when we talk about risk factors, increases the likelihood of young people, in our case, looking at using alcohol, tobacco, and other drugs. And then how do we protect them? What are those at the individual level, in the families, in the schools, in the community? How do we protect young people to give them skills individually, and then also looking at the environment to be able to make a choice not to use a particular drug at a particular time? And so just as an example of this, and we're going to use the chat box here, and we're asking to make some generalizations here. So this is just a drawing. This is a home situation, and we're going to identify risk factors here. If you look around this picture, you identify any risk factors or which would be a condition that might put, as you see there's one child in here, that might put this child at risk of harming themselves in any way. So you can look through here and you can look at some of the things here that may put the young people at risk of harming themselves. And so what risk factors, Kristen's asking, what risk factors do you see in this particular picture? Again, we are asking you to make some assumptions here, and that's all we can do. Okay, I can look around. Again, that's just the hot coffee. There's scissors laying around. There's a knife on the table there. There's laundry basket, the electrical cords in the, again, exposed. So again,
somebody said fishing poles. In the way, electrical cords.
When we've done this with the large number, we have real debates over the television. Is it a risk factor or it can be a risk factor? But again,
a lot of answers coming in, Dave.
Pardon?
A lot of answers are coming in.
Yeah, they are.
Well, and so what you're doing is, and what we're having you do here is do an assessment. And you can do assessment of any environment. If we were in a training room, we look around the training room and say, if we were to open a preschool here, what might put young children at risk? Exposed outlets, ledges, etc. So we can look at risk factors. You've done a good job of identifying some of these. And if we look at protective factors, maybe a little bit harder to spot. What are some of the protective factors here that we see?
Give a few seconds for their answers to populate.
Yeah, both parents are home. Again, and we'll talk about what the research shows about family structure. But again, the child has both parents. Obviously, it's a caring situation. I just realized I can't tell if that's a brother or sister or groceries that the father's carrying.
Somebody said attachment to the dad, to the parent.
Yep.
You know?
Fishing poles is one thing that could be maybe hooks that are exposed. That's a risk factor, but it shows they're doing hopefully healthy family outings going fishing. That's a protective factor. And so what we can do is, in the TV, again, if they watch educational television together and they discuss it with the child, then it can act as a protective factor. So again, you all are doing that assessment of your home in this particular case, identifying risk protective factors, and that's all we mean by walking upstream. And so again, there's a heart on the refrigerator. So again, there are risks in any given environment. There are risks and there are protective factors. So what we're going to do is spend the next little bit of time here walking through what these look like. And again, this drives our work in sessions 2 and session 3 of this training, because when we talk about developing strategies, obviously we're going to develop strategies that reduce the risks that youth are exposed to and that increase protective factors that buffer them, or the protective factors shield them from risk and promote healthy behaviors. Let's see, have I missed anything in the chat related to this? So when we talk about risk factors, it's a characteristic at the biological, psychological, family, community, or cultural level that precedes or is associated with a higher likelihood of problem outcomes. And so this is a key word. The higher likelihood is key, meaning the existence of risk factors in a person's life, in in their environment doesn't guarantee, it won't ensure that they have a problem with whatever the problem is, but it increases the likelihood. And the more risk factors we see in a child's life, the more likely they are to engage, in our case, in drug use. And again, another example of this is if we look at heart disease. And again, we could know the risk factors for heart disease. It's the diet you eat, whether you smoke, it's you have high blood pressure, do you have a family history. We all know these, and we also know that there are people that have all those risk factors, but yet they don't have heart disease. And so the point is these are predictive. The more risk factors you have, the more likely you are to engage in the problem or experience the problem. And so let's take a look at these risk factors. And again, what you will notice as you go through this, these are some examples of them just to provide you, and is when we look at availability, if youth have access to alcohol, tobacco, and other drugs, if it's easier, or even if they just perceive that it's easy to get the drugs, they're more likely to try to get it, and they're more likely to use it if they can possess it. So if in their community they know they can go down to a store and the store sells to minors, or if they know there's a certain parent that provides alcohol at parties, they're going to go to those places and find access to it. Same for prescription drugs, same for marijuana. Again, I'm here in Oregon where we have legalized marijuana. It's legal retail. People can grow up to 6 plants. So there's more availability, which means youth will have more access. So again, this is the agent, the host, and the environment coming together. If there's more access, more availability, young people are more likely to try it. So just walking through a few examples just to give you a feel. So again, community norms. Are there festivals in the community that promote the drug use? The youth, when they walk through the neighborhood, again, I'm pointing out Portland, Oregon here, there is marijuana use. It's legal. You're not supposed to use it in public, but if you walk down certain streets, you'll be able to smell marijuana use. If youth are exposed to that, they may not even be doing it themselves, but if they're exposed to the drug use, whether it's at a rodeo or at a family function in the community, they're likely to see that this is the norm, it's acceptable, they're more likely to use it. Again, you can start thinking of your own communities and what these look like. Another example is the parental attitudes. If parents think that alcohol is a rite of passage, or you've graduated, you can drink now, or, oh, they're just kids, I did it and I didn't have any issues with it. So if parents are not providing clear boundaries around alcohol and drug use in the community, not monitoring prescription drugs in the house, etc., then when parents have that attitude, that is portrayed to the children, and it increases the likelihood that youth may use particular drugs. And then the final one, just as an example, is the youth perceptions as well. We know, unfortunately, with marijuana, that marijuana is a medicine. It's natural. It's organic. So young people don't see the harm in using marijuana. They may not see the harm in using it before school in the morning or after school. Same with alcohol. Same with prescription drugs. Well, it was prescribed to me. It can't be that harm. Or vaping. I'm just vaping the flavor. There's nothing else. It's not harmful. If they don't see the harm or the risk of using drugs, if it's available to them, if their parents aren't providing clear boundaries, if a community is saying it's okay to use this, then all those risk factors increase the likelihood that young people may, again, choose to use drugs. And so what we're looking at here, and I realize this is a small slide, and this is in the handouts that we'll provide. Tracy did mention Drs. Hawkins and Catalano at the University of Washington, and Carlton mentioned Communities that Care. This diagram provides a nice way of looking at how risk factors operate. And again, if you can just conceptually, they've looked at all the risk factors and looked at a lot of research, and they found risk factors fall into 4 domains. And you'll notice as we go through this, different organizations put out different lists, different ways of presenting this. Fortunately, in our field, it's all based on research. So they may be providing different formats, but it's all, again, in order to say something's a risk factor, it's had to have been identified in multiple studies with multiple populations to show that when this condition exists in a community, in a child's life, it increases the likelihood of their using a particular a drug, or and we'll see here, in engaging in specific behaviors. So what this, again, conceptually what this shows is that risk factors, as Tracy mentioned, not only are predictive of substance abuse, but when we look at those risk factors for substance abuse. We need to change that to misuse. To also, they are predictive of delinquency, teen pregnancy, school dropout, youth violence, depression, and anxiety. So there may be other risk factors for these problem behaviors, but we know that when we address, for instance, family management, and we provide tools for parents to provide guidelines, monitor their children's youth, and provide appropriate consequences, we'll be doing preventions for, again, all 6 of these problem behaviors. So one point is risk factors address multiple problem behaviors. Another is they fall into different domains. We're not blaming any domain. We're just saying here's where youth experience them. It may be among their individual and their peer relationships. It may be they experience them in school or in the family domain or in the broader community. And then wherever you see a dot is that's where the risk factor has been shown to be predictive of that behavior. And again, we just went through an example of 4. You can go out to the communities that care and see this diagram. It's also in our handout. The whole point here is not every community has every one of these risk factors. So when we walk upstream and we want to do our assessment, and again, we'll talk about this in session 2, we want to look at these and say, which of these do we want to address? And I'm going to go back to my heart disease example. If my doctor doesn't do an assessment of my health and my behavior and my environment, and my doctor tells me to quit smoking, and I don't smoke, that doctor hasn't done me any good. So we want to be able to know what is happening upstream so we can address those risk factors that exist in our community.
Dave, can I add something here?
Of course you can. I saw you
I just want to sorry, Dave. I just want to quickly add to your awesome examples are really on point for a lot of us in prevention who's trying to learn what you're talking about, and I just think that is really great. And so I just want our audience to really just use those examples that Dave is supplying to you as ways to understand this dynamic, and that's just one way of doing it. It relates to prevention, and also I definitely wanted to just add as well. The dynamics of all those domains says to us is that we have to look in a broader aspect at the population that we're serving and what's really needed and where the risks are the most in our areas. And they may not be one, they may be 2, they may be all of them, but we have to identify from our data sets and what's going on, what are those risk factors and how do we act, how do we impact them. And I love across the board is that it goes all across all behavioral problems. And that's what I love about the community of care and the social development strategy that you have here is that it goes across all multiple levels of behavior. Thanks.
Thank you, Tracy. And again, so this is just part of the equation. And so what we want to do, we had a little challenge with the poll last time, but you can either respond to this in the chat box or in the poll. We'll try that again. We just want to give you a chance to think about
the poll is launched.
Okay, the poll is launched. And so just think about your community. And again, we're doing data collection here. If this is a community, I could be doing this with my coalition. But which of these risk factors, if we look at underage drinking, which of these do you see as the most important or the most prevalent risk factor in your communities? Is it the availability of alcohol? Again, what the youth experience, the community norms around alcohol use, are they seeing adults using excessively? The parental attitudes, the youth attitudes that may be favorable. So we're going to launch the poll. We have a little bit of time here. Leave it open. If you want to put in the chat box some other risk factors, go ahead. And while you're doing this, I just want to reemphasize what Tracy had mentioned is when we look at the role of your organization, there are too many risk factors across too many domains for any one organization to address them all. And so what we want to do, and the role of a coalition, a substance use and misuse prevention coalition, is to bring in sectors together so we can look at these collectively and say, okay, you're going to take on these risk factors, you're going to take on these. It's already part of your work. No one's addressing this one, availability across of prescription drugs, say, for example. We're going to take on this. So that's the role of a coalition. That's the role of a provider to look at that and say, what is our role in addressing this community environment?
And Dave, if I could add to that just one quick thought, and that's that I believe that the role of prevention is really to identify those populations and those areas where we are most vulnerable and to address them, to bring them to light. And part of what the risk factor framework really provides for us is a way that is science-based that we can identify in our community where are those vulnerable populations and how might we address those areas of vulnerability.
Thank you. And what you just talked about, Carlton, when we look at the poll results, the biggest one was community norms favorable, 34 respondents, youth low perception of harm, 25. The point is, if it is community laws and norms favorable, community norms favorable, now we can look at and say, what are those? Let's take those on, and we'll talk a lot about this in our session too. How do we really identify what those look like, what we as a community can change, what we have the political will to address, what we're ready to address? Those are all factors that go into identifying which aspects of community norms we want to take on. And again, that's the role of a coalition, to do that analysis, to do that. And we'll talk a lot more about that in the second session. Any other observations just looking at this poll? And maybe if there's any in the chat box, let me know. And people are saying there's multiple. Someone's putting in 3 or 4. Yes, there are multiple risk factors in a given community. That's why we do an assessment. Which ones, again, when you see one community, you've seen one community. And so we also want to address, we don't only look at risk, we also build protective factors. And so we can look at protective factors. Also, when we develop strategies, that's when we use our resource assessment to be able to say, how do we build protection as we address these risk factors? We do that simultaneously. So again, a risk factor increases the likelihood that of problem behaviors. Protective factors buffer exposure from that risk and decrease the likelihood that youth become involved in these problem behaviors. So again, what you'll see is, and we've mentioned communities that care, that's where Carlton and I have been doing this for years, where we got our start. But this is a nice operationalizing of protective factors. There's lots of ways that protective factors are expressed. Carlton mentioned developmental assets. That's another way of looking at protective factors. But there's different ways of looking at this strategy. And basically, you can go from the front to the back or the back to the front. If our goal is to create healthy behaviors in a community, and so what we want to do is set up the standards and norms and expectations that youth will achieve those healthy behaviors. So we want to, again, here's where boundaries, here's where positive information comes in about what are the harms. So we want to be able to say clearly what are the impacts of drug use and really promote those healthy behaviors. And so what we have found and what the research shows that when youth are bonded or attached to individuals, to organizations, to communities, to neighborhoods, to their neighbors that do promote healthy beliefs and clear standards, they're more likely to follow those healthy beliefs and clear standards. So our goal in prevention and building protective factors is to provide opportunities for young people to interact with peers who are making healthy decisions, to create in families an environment that's healthy, promotes healthy decisions and high expectations, engage in community organizations at the school level, after school activities that promote these healthy behaviors and provide clear standards for behaviors for the young people. And the way we can promote that bonding is making sure every youth, independent of their individual characteristics, has access to these programs. If we're in a rural community, is there transportation after school for young people? If there's a cost to programs, can we provide scholarships? So how do we promote youth taking advantage of opportunities where they can engage with others who have these healthy beliefs and clear standards? We want to make sure youth have skills so they can be successful in their interaction. They have skills so they can make healthy decisions. We want to recognize youth. We want to recognize families that are promoting these, because when the skills, opportunities, and recognition comes together, there's an attachment that's formed. Again, if the youth are involved in an organization and after-school activity that they feel part of, they're part of a team, there's adults there that are providing a positive influence, they're not going to, if they're bonded to that, they're not going to want to violate those bonds and engage in behaviors that'll disappoint others in their program if they're attached to it. So again, what we want to do is try to promote these skills, opportunities, recognition at all aspects of a child's life, among friends, in community organizations, at school, in the community. And if we do that recognizing that there are different individual characteristics that each young person brings to the table, we can promote those characteristics, whether it's resiliency or a positive social orientation. We can try to promote those. We recognize that some youth may not have a positive social orientation. We want to make sure that they do have an opportunity to engage. If they're shy, what can we do to bring them an opportunity that they still can engage even if they're shy? It's just one example. The whole point is we want to, as protective factors in building them, we want to make sure youth have an opportunity to engage and interact with others that have healthy beliefs and clear standards. Again, there's different ways, different language that you can use to describe these. The social development strategy operationalizes building protective factors.
So, Dave, if I can add as well, if people think about the risk factors and I look at the protective factors, you can balance both strategies and both sides of the table out. As communities, we look both at the risk factors, but we also, as Dave mentioned very well and succinctly, we look at the protective factors, those things that protect by offering opportunities and skills and recognition, which offers that attachment and that bonding, which offers those clear standards, and ultimately you get a lot of healthy behaviors. And so we as communities, I think one of the thoughts was, how do we promote youth taking advantage of opportunities to benefit from these protective factors? We offer those opportunities by saying what's already available in our community, what other opportunities can we bring to our community. We ask kids and young folks what other opportunities would they like to see happen in their communities, but we also look at the data to say what opportunities are not there and begin to offer those opportunities for all parts of our community and not just those who have the access to those.
Yeah, and again, Tracy, that's just one of the comments talks about parents fall under the community. We realize that, again, these domains aren't distinct. Parents operate within the homes. There's also parents operating in sports clubs or out in the community, and youth have an opportunity. So we want to just look at, again, you think about it, a child wakes up in an environment. They may go to, again, with COVID, they may be going to school in the home or going to school, but they go to school, they interact if they take a bus, they interact with the bus driver, they interact at school. After school, they may go into town, they interact with town. So again, in all these different environments, how do we set up, again, as a coalition, if you will, or prevention provider, how do we look at what are the risk factors, how do we decrease those, and how do we increase opportunities for youth to have protective factors in their lives? So one way to operationalize this for yourself is just, we're going to do another poll here if I can do this. In this poll, think about when you were young. And again, just some activity you were involved with or something that was in your life that was a protective factor. I think of my swim team when I was swimming 8 and under, 6 and under swimming. I was, again, that had healthy beliefs about working out, about staying in shape, about being healthy, and about practicing and about persevering. So again, they provided clear standards. So what we'd like you to do, this is a select all that apply in this particular poll, is say what were protective factors that existed when you were young. You may have grown up in an environment where there was a lot of risk factors, but there may have also been some protective factors. So again, you can put this in the chat box, or if the poll is showing, I need to show the poll.
The poll is launched. The poll is launched. You have just about a minute left.
Okay, thank you, Carlton. So again, just think about back to you, we're operationalizing this, and you can think about what were those opportunities that you had as a young child, or if you weren't able to, again, think about why you weren't. That gives us information about what we can do today to make sure all youth have opportunities.
Great. Folks are really chatting, so that's good. That they're giving us ideas as well as doing polls.
A sewing guild. Again, there's lots of ways that we have opportunities, and you think about, some people say, well, we have after-school sports. Not everybody wants to be involved in sports. What are opportunities that we can reach out to everybody? Okay. We'll get a sense. Again, the poll is just to give you a chance to think about and, again, operationalize these protective factors. And, again, a lot of people, this was multiple choice, a lot of people had multiple protective factors, and that's exactly what we want to do with risk and protection. And I'm seeing a lot of people have positive support. So who was that? And if you think about one of the search developmental assets is, are there 3 or more non-parenting adults that a child has a positive relationship with? How do we increase those opportunities for youth to engage with positive adults and positive peers and positive young adults?
And Dave, if I can add to that, how do we become intentional? How do we utilize our efforts? How do we take the resources that we are getting through these federal resources and translate those into intentional efforts to build these protective factors specifically? That's really kind of where and how we tie this all together.
Exactly. And so what you're talking about and what we've been talking about is really we address both. We try to reduce risk factors. If we make less them and we increase protective factor, we're going to sway the balance, and that's our role. We can't get rid of all risk in our community. We can promote protection for all within our community. And the whole point of, and again, when you think about the role of your organization, the role of a coalition, it's to be able to take a look at the community and say, okay, what are these risk factors? How can we address them? How can we promote protection so that everybody, we've talked about groups and segments of the population, everybody has access to protective factors in their lives. It may look different among individuals. Great. We need to provide the same opportunities in different ways for different individuals.
And then identifying those funding sources to do that really has an opportunity for our communities to really say, we have these risk factors, here's some protective factors, and we're going to look for funding that will help us identify that. I think that's really right on target, Carlton. So thank you for that impact.
Yeah, and when you think about coalitions, they're not doing all this work. As Tracy just mentioned, they're looking to say, okay, we have this great resource. We don't have to reinvent the wheel. Just people aren't able to access it, especially during COVID. How can we promote access to existing resources we have in our community? Exactly. So again, we've talked about the public health approach, which is really looking at that environment. We want to look at the environment across the continuum. And then for prevention, we want to walk upstream and look at what are these risk and protective factors that exist so that we can try to change that environment. Again, where the agent, the host, and the environment come together. Which allows us to look at the next piece, which we've already talked about, and when you think about the fish in the water, we talked about there are both individual strategies we can put in place to target individuals, and then there are broader, we want to impact the whole pond. What are those community-wide or environmental strategies we want to put in place? And we've talked about you need both, and that's when we talk about comprehensive strategies. So I'm just going to use another example here about strategies, and what strategies are doing are about changing behavior. So if we were in a room, I'd ask you to raise your hand, but I say, how many of you drive cars? You can raise your hand in your office or in your home. And then I ask you, how many, when you drive your car, know the speed limit? And most people know the speed limit. It's posted. And Carlton's raising his hand. I'm going to see if Carlton raises his hand on the next question. How many of you maybe have exceeded the speed limit when you're driving your car? Okay, and Carlton, you're not raising your hand, and I've driven with you. I know you have. You turned off the screen. So the point is, we have information. We know what the speed limit is, but yet our behavior, for some of us, they'll stop. If we see the speed limit's going from 55 to 35, we'll slow down. So information does change our behavior, but it doesn't always change our behavior. So what we need are multiple strategies that change our behavior. If there, with that sign, it said, there was a sign that said video enforcement. I'm going to slow down even more because I know there may be enforced, and 6 weeks later I'm going to get a letter in the mail saying I owe X dollars for violating the speed limit. Or if there was a law enforcement vehicle parked there, then I would slow down. Or I would ask, if you have gotten a ticket, I would ask you, does that change your driving behavior? For some people, yes. For some people, no. I do know that when I have gotten a ticket, I will slow down at that same spot where I got the ticket before, because I know I got caught before. The whole point is it takes multiple strategies to change behavior. Information alone doesn't change behavior for everybody. So when we're talking about comprehensive strategies, we can look at strategies that target the individual, and we look at strategies that target the broader community environment. Again, this goes back to the agent, the host, and the environment to be able to say, what can we do to provide individuals and families with skills they can make to build protective factors, to reduce risk. And then let's take a look at that community environment to say, how can we address availability? How can we change those broader norms in the community? How can we provide policies, both formal and informal policies or regulations, that seeks to change behavior. And again, this applies to COVID. We've looked at individual strategies. We get information from the healthcare. We get information from government, from a lot of different sources about what we can do as individuals to make ourselves healthy, to avoid getting COVID. And then there are things that are happening in the broader community that are trying to protect us from getting COVID and keep us away from the agent, in this case, the COVID. So again, and here's where when you look at roles, a lot of times when you look at a coalition or partners, if you think about the sectors, they're providing those individual services, whether it's in the faith community, whether it's in our schools or parenting classes. A lot of our partners are providing these. The role of a coalition in a lot of cases is to look at those broader community environments. If you think about the drug-free community grant, they're asking us to look at what is that broader environment, how can we put policies in place that impacts everybody in the pond, all the fish in that pond, all the children playing basketball at the basketball court. How do we change that broader community environment? And so when we'll talk a lot more about this in our second session, but there's different ways of looking at developing these strategies. And so this is from the CATCA, the Anti-Drug Coalitions of America. They've identified 7 change categories. Again, what these categories do allow us to think comprehensively. So we can provide information. If you think about if bars are selling alcohol to minors, we can provide information, put up signs, but that's not always going to change behavior. We want to do compliance checks. We want to train the servers. We want to train the police to conduct the compliance checks and the young people. We want to look at the consequences. Is there enough? If a bar is making $1,000 a weekend selling alcohol to minors and the fine's $100, well, I'm going to do the math. I'm going to continue selling to minors. If I'm going to lose my license, if there's graduated fines and I keep getting caught, then that's going to change my behavior. So we recognize it's going to take a range of strategies looking at each risk factor, each protective factor, and say, how do we, as a community, change the behavior we're looking at, change the condition we're looking at. And these are 7 that are, again, promoted by CATCA. They're also included in those that are applying for the Drug-Free Community Grant, is looking at these strategies. Those of you that may, another way of looking at this, the Substance Abuse and Mental Health Services Administrative, SAMHSA, the Center for Substance Abuse Prevention, in their block grant and other funding, they asked you to categorize your strategies in these ways. Very similar, looking at what is the range of strategies we're putting in place to be able to change behavior, because we recognize that any one strategy doesn't change behavior. We talked about a handout. Each of these descriptions of comprehensive strategies are described in more detail in those handouts. Our point here is to say several points. One, it takes a range of strategies to change behavior. We want to look at and say, what are we already doing? There are already existing programs in our community. Again, we've already got curriculum in the school. We've already got parent services. How do we make sure everybody has access to those? That's the role of our organization, to make sure that these strategies are available to everybody and impact the whole community.
And Dave, may I also add here, as you've seen the comprehensive strategies from CATCA, the comprehensive strategies from CSAP, the clear message for us in prevention is that you can't do this and you should not do this alone by yourself. This is not about, being that one hero, but as Carlton says, you have to be part of an Avenger, or maybe I'm using the wrong group, Carlton, but some people like the other group, but the justice group, but you have to be part of a team. So a good prevention person really understands these dynamics and really begins to identify who are those partners in the community to help provide this comprehensive array of strategies to impact that. And particularly in a lot of our settings where we don't think that where we don't have a lot of resources, there are those resources. We have to be able to access those. So thank you, Dave.
Yeah, and that's, again, what is the role of our prevention coalitions or as providers? It's exactly as Tracy just said. How as a community can we coordinate our services so that we're, again, changing that environment where the agent, the host, and the environment come together. Exactly. So I'm going to wrap this up, and then I think Carlton's going to lead us in a poll in a break. But the last poll we have is just to get a sense for you, and this is just to get your thoughts, is what is the role of a coalition of prevention providers? We've been talking about it through each of these 4 key concepts. Implement the SPF means, we'll talk about that when we come back from break. is what is our planning process so we can walk upstream and identify those conditions in the community. So what's the role of a provider? Is it to do that assessment and do that planning? Is it to provide information? Is it to address risk and protect the fact that they're all right? What we're asking you to say, which one you most agree with. We're forcing you to select one. Is it to actually implement our strategies? Is it, as Tracy just mentioned, is it building resources to address these or others described in the chat box? Again, we realize you want to select them all. If you had to pick one, which is that you most agree with? With that, I'm going to turn over to Carlton to dissect the poll, and if Kristen can give us control to Carlton and to lead us into a break.
No problem. First and foremost, thank you very much, Dave. Extraordinary presentation, extraordinary leading us through that conversation. Thank you all. Kristen, if you don't mind, go ahead and close the poll and let's find out what the respondents said at this point. I don't know if we had, were you able to do that or no? There you go. All right, so we see that there's a whole range of, as there has been throughout this. It seems like you all are coming from different places, different perspectives with different needs. And that's exactly what we were hoping that we would find, and we're hoping that we're able to speak to each of those. Please put your conversations and your comments in the chat. What I'd like to do is right now, it's quarter past. Forgive this, but I only want to give us 5 minutes, just a bio break, 5 minutes, folks. It's just a stress. Step away from the laptop. Do not log off unless you intend to leave the session, but just step away from the laptop, 5 minute stretch, get some water. We'll come back, and when we come back, Tracy's going to show you how each of these tools that Dave just talked about really works within a system of prevention, We're going to talk about that after the break. 5 minutes, we're going to start talking at 25 after. Thanks. Good enough. Just 2 more minutes, folks. Just 2 more minutes. Kristen, can you give Tracy the presentation power?
Que piensa que está chorando, que no va a quitar pasar, é saudade, é tristeza, é lembrança de minha infância, é fantasia da criança, deixa a solidão, vai consolar minha fraqueza, é lembrança da infância, é fantasia da criança, deixa a solidão. Para consolar minha fraqueza, que flor que está murchando, que criança que está chorando, que nuvem que está passando, é saudade.
All right. All right, we're going to bring it back, everybody. Thank you so much. We will promise that we are going to end on time to make sure that you all are able to plan well for today. And so with that, I want to just ask Tracy to take us into this next session. We are going to have an opportunity for a bit of Q&A and some final comments after Tracy's presentation. Thanks so much.
Thanks, Carlton. Thanks, Dave. Thank you all for coming back and staying with us. I see the numbers are still staying the same. So I want to touch a little bit about the strategic prevention framework. And although we'll touch more on it in our other trainings, our next training and so on, so I won't really go over this specifically in detail, but I want to give you some 10,000 feet views of what the framework is all about, okay? So one of the things I want you to think about, and even chat, put this in your chat, what elements of the SPIF has your coalition organization completed in the last year? Has there been assessment? Has there been capacity? Has there been planning? Has there been implementation? Has there been evaluation, cultural competence, or sustainability? And if it's none of them, that's okay. But we want to know where are you at as it relates to your particular coalition organization and its in this relationship. So, go ahead and use that chat, y'all. I'm looking forward to this because that's our way to communicate with you all, and you communicate back with us. So we want to hear from you, and we want to appreciate you engaging in that process for us. Okay? So as we look at those, people saying planning, people saying capacity, that's wonderful, awesome. So let me take a few minutes, if you will, and some folks have used all the above, awesome, and continue to use. One thing about the framework, we call it the SPIF for those of us who've been around this while, but we call it the SPIF, and it includes 5 sort of key steps. And then the uniqueness about this flower, as you see in front of you, that it provides 2 critical overarching dynamics to it as well, okay? First is that, in any good work, and I want you to think about, you may do this even in your own setting without doing work around in your own personal life. Assessment is really important. You have to assess what the concerns are, what the related problems are, what the behavior are, and then you have to decide, which one is going to come first, which one is going to come next, so on and so forth. So assessment is really a critical piece in our work within our community to really identify those areas that really need it, and then identify, okay, which ones are we going to really focus in on? Because we can't do everything. We can't do all the data at all the time. And every time I think of these steps, I think of myself as what my physician does for me when I go. My physician assesses my concerns. He or she also says, okay, let's look at you, Tracy, and let's see what the concerns are. And then my physician says, you know what, Tracy, in order for us to make sure I can help you really well, I need you to also think about capacity, Tracy. I want to engage other people in your health, Tracy. Or I want to engage people in your community and engaging other folks to help you really become well. And so next step is capacity building and developing and strengthening that sort of good group of folks we call prevention team, and folks that are really going to help sort of build that capacity. And a lot of times my physician says, I want you to go to the phlebotomist, I want you to go to x-ray technician, I want you to go to the health clinic, and that's my team because I'm building capacity to really help you come well, Tracy. So that's another way when we talk about the SPIF process. Oops. Okay, Tracy. So then after capacity is also, before we do anything, one of the greatest things about our work, and even I used to be guilty of this, I always used to want to jump in and do implementation right away. But we want you all, even new in this field, to understand we go through those first steps, the first two steps first to get a sense of, is it really something I really need to be focusing on? Am I doing the right thing? Because I need to do some planning next. I need to really lay out a real structured framework, what we call, you see there on your screen, a logic model. And these steps really help, the planning process really helps to engage you to think about what do you really need to do and be intentional about that. And we'll talk really, really more in detail about what that entails. But I even think when my physician says to me about, Tracy, before we're going to do anything, I got my partners involved. Before I do anything with your health, let's think about things that you might need to do. Let's plan some things out about how you're going to really get involved with your behavior. Maybe you need to walk more. Maybe you need to eat certain types of food. Maybe you need to da-da-da-da-da. And so I really need those, believe me. But at the end of the day, it's really about laying out that plan in good work and good strategic preventive framework or SPIF work is really laying it out and planning it. Okay, now, finally, y'all, is the time to do implementation. This is that point where we've been waiting to do. But isn't that amazing that now we have an intentional and framed mind to do it? Because now we know what our data says. We know who's going to be our partners involved, and now we've laid out a plan before we step out there. And implementation is really delivering that program, that practice, and doing it with fidelity. But although we know we have to adapt, and I work in urban communities and minority communities around the country, we know that those things have to be adaptable to those populations. And so when you're doing implementation, one community just fits one community, as Dave would say. So you can't expect to deal with a certain group of population when you implement it. So you want to implement those things. You want to retain and implement those core components that really that's important. And then you want to move further and then establish that implementation on an ongoing basis in an ongoing framework. I have a happy trigger here. And then, of course, there's evaluation. And then at the end of the day, evaluation is really critical, and that it really helps support those. And then because that helps you measure what you need to do. And then the unique thing about evaluation, about the SPIF, is that it encompasses these two critical areas: cultural competence and sustainability. Cultural competence and sustainability. And the unique piece about these two dynamics is that they're infused with all parts of the framework, and they're infused with all parts of each of those steps. And so you need to understand what those are and how we say are we culturally competent in our assessment process, in our capacity process, in our planning process, and even in our implementation and evaluation process. And also, are we culturally competent? How are we sustaining those areas of outcomes that we did in each one of those steps as well? How we developed a sustainability plan? And then this next document will be on page 13 in the workbook that we're going to deliver to you, is that it really helps you provide a checklist, if you will. And that checklist provides you to say, how are we as an organization or a community around each one of our steps, the assessment, the capacity, the planning, implementation, and so on. Are we high? Are we medium? Are we low level? And that gives you a nice initial checklist in terms of how well you're performing each one of the SPIF steps and frameworks and what we're trying to accomplish.
And Tracy, if I can add to one of those things and also do a shameful advertisement for our session 2,
yes,
is that, again, you started with assessment. That data that we collect in assessment is critical because that's that walking upstream and finding out what are these conditions in our community. And we use data because if we say parents are providing alcohol to minors, in their homes and we go to do a social host ordinance, I guarantee you the city council or the county council is going to say, how do you know that's a problem? We better have data to back this up. What's exciting is that same data we use to identify the problems, the root causes, the risk factors, protective factors. We use that data in our planning to be able to say, these are our goals and objectives. These are our priorities. We use that same data in our implementation to say, are we impacting? We don't want to wait till the end or every 2 years when a survey come out. We use that data to say, are we having the impact that we want to have? And obviously, we use that same data for evaluation to be able to say, did we have the impact we thought we were going to have or we hope to have? And we use that same data for cultural competence to say, are we engaging the broader community? And we use it for sustainability to be able to say, hey, we've had, as a community, as a coalition, we've contributed to changes in our community. We need to sustain this effort over the long time in order to have the impact, the community-wide impact that we want. But this is an advertisement for assessment to be able to say we use those data throughout. That's why that SPIF is a circular, if you remember spirograph. It's a circular process that we continually are using the data to drive our planning, drive our implementation, our evaluation and adjustment.
And it really is the first, thank you, David, it really is the first part of what we do because, you know, when we talk about knowing that where that data is and getting data resources in our community, there are people that I've found in the back in the office of the sheriff's office, a person that just collects data. And he or she is a good data source because we can't move when in the framework, in the SPIF framework, we can't move until we do this step first. Because just like any good physician, I don't want him or her to do anything with my body until they know what the data says about who Tracy is, what are my numbers, what are my blood pressure, what is this, what is that. And so a lot of times I tell communities and I tell prevention folks that we have to be the physicians of our community. Okay? When I say that, as I say that, we have to do just like our physicians do for us, is that we have to, first of all, collect that data about our community before we just go out and do anything. And this, in fact, says there are a lot of good data sources. People who love data, people who just attracted to data, and they'll share that data. And sometimes getting them together to talk about their data helps really get your data information that's going to target specifically for your community. And our role as preventionists is to engage that individual or individuals to talk about those data and then present that data to us either as a coalition or as an organization. And then it's our responsibility to identify what are some of those key areas that we want to focus on and where we want to be at. And so that's really important to understand. And then another example real quickly for capacity is that at the end of the day, I always tell people at this step, and I just thought about it, is that this is that readiness step. You know, the key is as we start the capacity level, we also want to measure that level of readiness. A lot of times when I go in certain communities, you know, although we may have the awesome data that we need and we know there's some concerns there, but if your community is not ready, then unfortunately, anything that you do from this point on is a moot issue. So measuring the level of readiness of your community, and there's a lot of tools we'll talk about at another time that's really out there for you to really utilize that and implement that. And so this level really engages that stuff of getting the right folks to the table, getting the key folks to the table, and they know that they have to be part of this and that, you know, not waiting to the end when you're ready to implement. You know, and I have to admit again, I know in your community you don't have those turf issues. So bringing stakeholders together is a great thing, and so I know you guys don't have that. But in some communities where there are some turfisms that we have to bear, we have to be the ones that help knock that down by critically developing a strong a relationship with the folks in our community, building that trust with the folks in our community, and capacity building helps us do just that. And then finally, just real quickly, and when I say again about planning, you know, y'all, this is really critical. If you don't plan, you fail. You know, and so at the end of the day, I don't want my physician not planning out my diagnosis and my prognosis on what I need to do, and then I have to. The community is relying on us as preventionists to do the same thing. Is is to plan out our level. And, of course, as I said there, bringing folks on board to do the implementation. This is the greatest part that we all look for. This is the part that puts the hairs on the back of our neck when we want to do stuff. It makes us feel good about who we are. It really gives us an opportunity to engage our efforts around good implementation strategy because we like this part. But in order to get to this part, we have to make sure we do our homework and really move forward on that. And then finally, understanding the importance of how we measure what we do and to evaluate what we do and to ensure that what we're doing has impact. At the end of the day, when I go see my physician, he or she gives me my measurements from before when I first came in, and he or she says, we've seen you change in this area. Tracy, you lost some weight. Tracy, your AC numbers are here. Hey, Tracy, your blood pressure numbers are here. And so we want to do that same thing for our community. We want to be able to measure and be able to show, as physicians of our community in prevention, we want to be able to measure and show our effectiveness in our evaluation and our work. And in each step, no matter what, we want to do cultural competence. Carlton?
Yeah, I was wondering if I can ask us to do something here just slightly different. Between you and Dave and I am certain we have worked with thousands of communities and coalitions in their attempts to implement the strategic prevention framework. And part of what it is, I can understand that many of the folks that are listening to us are looking at it, okay, how do I apply these tools and these concepts that Tracy's offering, that Dave's offering? So I wanted to ask each of you in turn, Dave and Tracy, if you can identify one or two challenges that you've come across that coalitions or communities have had in any of the given steps. Like, what are the most pressing challenges that we believe that these new preventionists that are on with us today might definitely experience? And so I'll give a half a second or half a moment to think about that. But I know one from my vantage point is when it comes to the assessment piece, that they have a really, really difficult time engaging the community in assessment because their communities feel as though they've been assessed to death. And they have some challenges with trying to folks and engage folks in an assessment process when the community believes they already know the answer. The answer is obvious. Like, we can see it outside our window. How do we get communities to engage in this assessment process because, this grant program told me I had to do an assessment or the process says we have to do an assessment. How do we do that? Other questions, other thoughts from you, and I'll go with you first, Tracy, and then to you, Dave.
Sure. I think, you touched on the one that I've seen very much as a difficult one, and that's assessment, especially when I work in communities of color, Black communities particularly around the country, is that ability to really get the data specifically for their targeted neighborhoods and communities that they define as communities. And so that's one of the ones that I found that they have been able to have to deal with. And one of the things that we've worked with them, and as you know, Carlton, in our work in Philly and other cities, is that we've tried our best to engage communities to bring the key partners because of their relationships with folks, to bring through the aldermen, the councilmen, the city folks, to bring to bear how to access that data. But then I think one of the biggest ones that I come across, in particularly in communities that I work with, both large and small, is capacity. Is the ability for folks to tear down those turfs, and the ability to say we're in it to win it collectively and not in it to win it individually. And I think capacity is really critical, and we'll talk about it at our next sessions that we do. But there's several key things that we could do to make sure that we build capacity.
Absolutely. Dave, any thoughts about where communities are having the most difficult time implementing the SPIF from your perspective?
Well, our answers are walking through the SPIF. You mentioned assessment. Tracy mentioned capacity. I'm going to say, as Tracy mentioned, there's a lot of excitement to implement, to do things. And one of the challenges people experience is keeping focus on what is it we want to change. And the answer to that is, for those of you that know the training, is a logic model, whatever you call it, a roadmap, helps to provide that focus. And we'll talk about, I'm advertising for session 2. We'll talk about this. How do we keep that focused to do enough to change again, community norms. It's not easy to change that. But how do we, what are those conditions, and keep our focus on changing those norms? And that goes back to what is the role of a coalition, what is the role of any given preventionist, is to provide that sort of attention that Carlton mentioned, I believe both of you have mentioned, intentionality in our work to keep our focus on this particular risk factor, this particular protective factor.
Thank you. And one of the key things that we were trying to express with the earlier Swahili kind of activity is that very often we go and we attend trainings like these and we learn about the SPIF, and what we tend to do is we learn the language of prevention. We learn the language of the SPIF. It is very important for us to be able to understand truly how these tools are being able to be put in place. So, for example, an analogy that I use is I love a good garden. I used to say I love the garden, but that's not actually true. What's true is I love a good garden. And in it, and to that point, I look at my neighbor and I see my neighbor has a beautiful garden. I look at the tools my neighbor uses. I get in my car and I go to Home Depot and I buy those exact same tools. But I'm here to let you know that my garden still looks nothing like my neighbor's garden. And that is because even though you are using the same tools, the same concepts, the same tactics, there is a difference in how you apply them. And that's the difference in communities that are applying the strategic prevention framework well and other communities that are still struggling with that. Understand that it goes beyond the language. It has to be about understanding how to make best use of it as a tool. And part of what it is that we hope that we're doing with this is to provide a conversation about that, and we're going to go and delve deeper into it over the course of the next few seconds. But I just really wanted to get that. And one of the key tools that we're providing you to help you with this is this checklist that Tracy just introduced to you, right? And Kristen mentioned that the resource book, the resource guide that we have been talking about is currently on the website, the Southeast PTTC website, as a resource associated with this specific training. Kristen will explain at the end of this how to make sure that you're able to access it. But so all of the tools we talked about are identified there. There's a lot of resources in there, but one of them is this SPF checklist, and it really helps you to gauge how well you are actually implementing and where you may need to focus on each of the areas of this strategic prevention framework. So this training today was not intended to go deep and do a deep dive into each of these aspects, because they just simply didn't have the time, but it is to help you to understand that this is the system by which you're able to apply those fundamental prevention science tools that Dave talked about in the earlier portion, that those tools are implemented by the use of this systematic framework called the SPF. What I'm hoping that you can do now, guys, is here's the time to engage you in this conversation. What questions do you have? What questions do you have for either myself, Tracy, or Dave throughout this that relate to the key concepts of either the public health approach to prevention, as Dave kind of talked us through the importance of those three components, the agent, the host, and the environment, and how important that is to us. The continuum of care, and the ways in which both Dave and Tracy talked about how each of the aspects that we are, even if we are preventionists, we are responsible for understanding and relating to all the areas of the continuum of care, because all of them, if our communities are going to thrive well, need to be applied. Risk factors and protective factors. Comprehensive strategies, how much do you recall about that? So what questions or statements or comments do you have? Please put that in the chat now so that we can gauge. Please don't miss taking advantage of the fact that you have three old guys that have been in this field for a long time and have worked in communities of every type and how to apply it. And yes, this is being handled. And Kristen, you and I can go back and forth with respect to the questions. I see a question from Hill. Oh goodness, it's coming to. Hold on. What strategies to have commit to using the tools we teach over the long haul? What are strategies to have commit to using the tools we teach over the long haul? Is the first question I see from Hill. I'm assuming how do we engage in utilizing this and utilize strategies to engage folks over the long term? Dave, do you have a response to that?
Well, I just think when we talk about sustainability is what I think Hill is talking about, and sustaining this. And part of it is exactly what we're doing today. It's that transparency of the process and recognizing people know that if we can all engage in an ongoing basis of this process and take advantage of these tools that are available, and let people know that, again, there's lots of websites, and again, we'll talk about these more, where we can get tools for assessment, tools for planning, tools for strategies. There's another question about, do these strategies work in Indian country? And again, we've done webinars for that. There's a lot of these tools. So the very big picture answer is being transparent about engaging people and providing the information so they can see that we are part of a bigger effort nationally and in our communities to be able to address it. That transparency is important.
Yeah, and then also noticing that you have to be, each one of those steps have to be culturally engaging for Native populations and communities as well. And so what happens in one community, like Dave said, happens in one community. So we can't expect to use the same strategies in one community that would affect other communities of color like Native American populations.
And just one other point, when we talk about, and again, we'll talk about it later, evidence-based practices or best practices. There is, again, being research, and there are publications and sites around Native American best practices or tribal best practices. So again, they need to be applied appropriately, as Tracy's talking about, in a culturally appropriately. We are learning from each other. Tracy walked through the history of prevention. That's one of the things we've learned. Let's learn from each other. In prevention, we don't steal from each other, but we do borrow heavily from each other. To, again, what has worked there? How can we apply that appropriately in our communities?
Uniquely, there's a National Native American PTTC that you could use, and that's a national one. And so I'm sure Christian can put that on as well, because they have some awesome strategies on how they've implemented SPIF in those communities as well. Sorry, Carlton.
No, don't be. You actually said what I was going to offer. There is a prevention technology transfer center that is focused exclusively in just what we just talked about, how to translate these tools and these efforts and these works specifically for the cultural needs of tribes and tribal communities across the country. And so that's very important. It's also important to really understand that Dave, Tracy, and I have direct experience with working with all communities, including tribes. So we are experienced in doing that. For example, the translation for each of these. Which one of you are playing with it? That's
my mistake, sir. Forgive me. My mouse is when I'm touching my computer, my mouse automatically just.
It's all good. No worries. So I want to make sure that you're able to explain that. Let me just see, Kristen, do you see any other questions that may be in the chat for us or in the Q&A for us?
Go ahead, Dave.
There's a question about using the class standards, and if I understand, that's a way of looking at diversity within a community and looking at different aspects of that. And that clearly plays throughout, especially Tracy spent a good time talking about capacity, is we want to make sure we're engaging all aspects of our community, and we can use those standards to identify, are we, again, doing outreach and engaging people of all from diverse populations, and then developing engaging them and developing and implementing appropriate strategies. So that's one way where the class standards can inform us. Other thoughts on that?
Without going into each of them, of course, can you just give an overall definition of class for those who are not familiar with the phrase and the term?
I'm going to just do a start, and then you can add to it. But from my understanding, I don't know what the acronym stands for offhand, but it's basically looking at different aspects of diversity within your community. When we look about age diversity, race diversity, culture, ethnicity, so we can look at different aspects of diversity within our community.
Thanks, Dave. So it stands for culturally and linguistically appropriate services, and they are standards that have been identified by a federal agency, a federal institution, SAMHSA included, which really help to do exactly what Dave just mentioned. And in fact, what we're able to do is we're able to, I think, Kristen, maybe identify a future webinar where we can go directly into that, because it really is helpful in thinking about how to speak to diverse communities with respect to prevention. It's a great, great, great tool. It can be complex. That's why it's really important to kind of break it down.
Yeah, and I also think that a lot of times I've encouraged a lot of communities, and when they get to that cultural competence piece of the SPIF, is that they utilize some of those class standards to engage these steps of that SPIF process. So,
Kristen, can you give me control?
Yes.
Somebody says, hey, great, old guys rule. Todd Mauger says, old guys rule.
Fantastic. So thank you. I'll take that anywhere I can get it. Great conversation. We are intending to be able to have these kind of conversations in the next number of sessions. One of the questions came up about what's the difference between these sessions and the masterclass that we're going to hold kind of at the end of all of this. So the next session that's going to be coming up on December 15th, next week, is really, as Dave and Tracy already went into and alluded to, really taking us more deeply into assessment, planning, and evaluation and how that works together, and the tools by which we will be able to utilize for that. We will then come back at the beginning of the new year with looking at community organization for prevention professionals. And what we're really intended on that is, what is it that we need to do? What is it that we need to consider if we're organizing our community on behalf of prevention efforts, which may include also considerations for all kinds of communities, including tribes, communities of color, and the like. So we'll be having an opportunity to speak more deeply into those efforts. And then the master class, and the distinction is that we're going to each of the subsequent sessions are going to be 90 minutes as opposed to 2 hours that this was. And it's going to be a lot more focused. What we will do in the master class is we will have an opportunity for 40 folks to be able to register for that master class. And that master class is really about, after you've been a part of each of these sessions, and you've tried to implement these tools that we're offering, what are the challenges? What are the issues that you've come up with? And us being able to do a deeper dive in exploring how you might be able to address those issues and those challenges that you may be coming up with. And it's a way for us to listen and learn with and from each other as we do that. And so we've designed something that we hope will be a very valuable kind of discussion and conversation and meaningful dialogue. There will be Tracy, Dave, and I, along with a number of other prevention specialists and experts that will be helping us to facilitate that conversation. So it's a deeper dive. And Kristen, if you want to add a little bit more about how folks might be able to register for all of these courses, including the masterclass, please go right ahead.
Well, I've been putting in the chat here the links to the second training and the third training. The master class, as Carlton said, is going to be extremely limited as far as attendance. So I am going to, we're going to do it in Zoom, and I will be emailing all of you the link. So if you're interested in it, please register. If you think maybe I might be interested, I would say don't register, because you want to leave it open to other people who really are very interested and definitely want to participate in that master class.
Thank you so much, Kristen. And so with that, I want to just share with you all just how honored we are all for having this opportunity. We went through a lot of information in a very abbreviated time, but I'm hoping that it was digestible for you, and I'm letting you know that it is intended that we're going to continue this conversation with these future sessions. But I am struck and reminded by the fact that everyone that has participated in this training today are all part of a really unique and very wonderful club. It is those of us who really care passionately about bringing change. I wish for everyone that everyone has an opportunity to meet your heroes. I was able to have a great opportunity to meet one of mine, Congressman Lewis, as you can see there in the picture, while working with, quite frankly, the Cherokee Nation. We were really happy to be working together and having the opportunity to be at the same event and working together with respect to them, where he had an opportunity to share some things privately with me. And one of the things that he shared is something that he's very, very well known for, is the importance of this concept that he referred to as those of us who like to get into what he referred to as good trouble. You can see the quote that he has there on the screen. I just want to take the opportunity to say thank you all for being folks that like to get into good trouble on behalf of the communities that you serve. I'm going to share a thank you to Dave Shavel and to Tracy Johnson, extraordinary leaders and champions. Thank you for the wealth of knowledge and information that you provided. It's always fun when we get to play together, so I'm grateful for all of that. Thank you so much, and we're going to have an opportunity again on December 15th. And with that, I'm going to turn it back over to you, Kristen, for our final words and get the evaluations done.
Okay, thank you so much, Carlton, and thank you to everyone who participated in the chat.